Hello everyone, welcome into the ITLS Academy. Myself Dr. Himani and today lectures on nutritional assessment. So we will talk about the nutritional assessment. So let's start with the introduction. The nutritional status of an individual is often the result of interrelated factors. It is influenced by the adequacy of the food intake, both in terms of quantity and quality, and also by the physical health of the individual. The nutritional status of an individual is often the result of many interrelated factors. It is influenced by food intake, quantity, and quality as well as physical health. The spectrum of nutritional status spread from obesity to severe malnutrition. So now here we will discuss about the definition of the nutritional assessment. So, an ideal nutritional status occurs when the supply of nutrients conform to the nutritional requirement or needs. Refer to the degree of balance between nutritional intake and nutritional requirement. This balance is affected by many factors, including physiological. This balance is affected by many factors like physiology, physical development, cultural and economic. So we can define nutritional assessment is the interpretations of anthropometric, biochemical, clinical and dietary data to determine whether a person or group of people are well nourished or malnourished, or you can say like that they over nourished or undernourished. Now, why is nutritional assessment is important? The stage of the body with respect to each nutrients and overall body weight and conditions is a powerful factor in promoting health and preventing and treating disease. Weight loss of 10% or more has been associated with adverse outcomes and prolonged hospitalization and in lean, healthy people, but more than 35% weight loss has been associated with that. So, nutritional status affect immune response and response to medical therapy. So, health care providers assess client nutritional status for many reasons. First one is the to identify people at risk of malnutrition for early intervention or refer before they become malnourished. And second one is to identify malnourished client for treatment. Malnourished people who are not treated early have longer hospitalized stays, slower recovery from infections and complications, and higher morbidity and mortality. So, to track child growth and to identify medical complications that affect the body ability to digest food and utilize nutrition, to develop healthcare programs that meet the community need, which are defined by the assessment. And next importance of the nutritional assessment is to measure the effectiveness of the nutritional program and intervention once initiated. Now we will discuss about how often should nutritional assessment be done. The frequency of nutrition assessment depends on a client's age and pregnancy and disease status and on national policies. The recommendations below should be adjusted based on national guidelines. First one is the pregnant and postpartum volume. It is the on every initial visits. Second one is the infants 0 to less than 6 months of age at birth and on every scheduled postnatal visit. And next one is the infants 6 to 59 months of age during monthly growth monitoring session for children under 2 and every 3 months for all children. Next one is the children 5 years of age and over and on every clinic visit. And last one is the adolescent and adults. So on every clinical visit, people with HIV on every clinical visit and when initiating or changing antiretroviral therapy. So next one is the method of nutritional assessment. Here is the two type of method for the nutritional assessment. First one is the direct method and second one is the indirect method. So the direct method deal with the individuals and measures objectives criteria, while indirect method use community indicates that reflect the community nutritional status and needs. So let's discuss about the first direct methods. So they are summarized as like a ABCD. So first A is anthropometric method, second one is the biochemical laboratory method, and third one is the clinical method, and next one is the dietary evolution method. So first we will discuss about and next we can discuss about the indirect method too. So indirect method of nutrition assessment is ecological variables including agriculture crops production, economic factors like households income, per capita income, population density, food availability, and prices, and culture and social habits also, and vital health statistics also included in indirect method of nutritional assessment like um, mor- morbidity, mortality, and other health indicators like infant and under 5 mortality, utilizations of maternal and child health care services, fertility indices, and sanitary conditions. Now, first we will discuss about the direct method of nutritional assessments. First method was the anthropometric method. It is an essential component of clinical examination of infants, children, and pregnant women. These measurements are compared to the reference data of the same age and sex group in order to evaluate the nutritional status. So, although they indicate the nutritional status in general, still they are not used to identify specific nutritional deficiency. They are used to evaluate both under and over nutrition. The measures value reflect the current nutritional status and don't differentiate between acute and chronic changes. Anthropometry include the measurements of height and weight and the calculation of the body mass index is called BMI. So BMI used to assess overweight and obesity and to monitor changes in the body weight. BMI is an anthropometric indicator based on weight to height ratio. It is used to classify malnutrition in non-pregnant and non-postpartum in adults. So calculate BMI by dividing a person weight in kilogram in kg by the square of a person height in meter. You will have to convert measurements in centimeter to meter. It's like 100 centimeter is equal to 1 meter. So here this is the formula. BMI is equal to weight in kg and height square in meter. So BMI value in the WHO range for normal nutritional status indicate a need for nutrition interventions to slow or reverse weight loss or to reduce overweight. Other measurements include a weight history and possibly a waist circum, circumference measurements. Even you can see in this pictures also, if BMI is less than 16, then it is the severe malnutrition. It indicate the nutritional status is like the severe malnutrition. If the BMI rate is greater than 16 to less than 17, that means it is the moderate malnutrition. And if BMI is greater than 17 and less than 18.5, that means it's a mild malnutrition. And if BMI is greater than 18.5 and less than 25, that means normal nutritional status. This is the normal nutritional status. So generally, if you want your normal nutritional status, your nutritional status could be normal. So you should be take precautions, and your BMI rate should be in the range of 18.5 to 20, in between 25. And if BMI rate is greater than 25 and less than 30, that means person is overweighted. And if the BMI rate is greater than 30, that means person is obesity. Now here's the other anthropometric measurements. It's like first one you can use mild arm circumferences, second one is the skin fold thickness, third one is the head circumferences, fourth one is the head and chest ratio, next one is the hip and waist ratio. So next we will talk about the direct method is biochemical assessment. Biochemical assessment means checking level of nutrition in a person blood, urine or stool. Lab test result can give trained medical professionals useful information about medical problems that may affect appetite or nutritional status. Lab measurement done on available body tissues, usually blood or urine. So it measures could be by the nutrients, metabolites, and substance that contain the nutrients like Hb for iron and enzymes that require the nutrients like transketolase for thiamine, and next one is the substances that result from abnormal metabolism from a deficiency of the nutrients. Like example could be like evaluated pyruvate level in thiamine deficiency. Biochemical assessment is useful in detecting early change in body metabolism and nutritional before the appearance of over clinical sign. So biochemical assessment could be pricey, accurate, and reproducible, useful to validate data obtained from dietary method like example we can say like that comparing salt intake within 24 hours urine excretions. So here is the some limitations of biochemical method. First one is the time consuming, second one is the expensive, third one is the they cannot be applied on large scale, and last one is the need trained person and facilities. Now we will discuss about the third direct method of nutrition assessment is clinical assessment. So clinical assessment include checking for visible sign of nutritional deficiency such as bilaterally pitting, edema, emaciations, is like emaciations is a sign of wasting which is loss of muscles and fat tissue as a result of low energy intake, and or nutrition loss from infections, hair loss, and changes in hair color. It is also include taking a medical history to identify conformity with the nutritional implications, other medical complications, uses of medications with nutrition related side effects, food and drug interactions, and risk factor for disease like smoking, alcohol use, overweight that affect or are affected by diet and nutritional status. So, assessment of nutritional status in infant under 6 months involve checking for clinical sign of acute malnutrition such as conjunctival pallor, pitting edema, vital spores, watery, infective breastfeeding, and recent weight loss or failure to gain weight. Clinical nutritional assessment also include checking for and asking client about symptoms of infection that can increase nutritional needs like fever and nutrition loss like diarrhea, nutrient loss like diarrhea and vomiting, as well as a medical condition like HIV, and that impair digestions and nutritions absorptions and increase the risk of developing malnutrition. Medical reports should provide information about illness, hospitalization, operation, diagnostic tests and therapies, and medications that can affect nutritional status too. So here we can see the pictures of conjunctival failure. So what is the actual conjunctival failure is, um, in this conjunctival failure may be a more accurate indicator of the presence or absence of anemia than failure of the palm or nail beds. In addition, conjunctival failure has been documented to appear more frequently in patients with severe anemia and hence may be more sensitive than other signs. And next one is the pitting edema. What is the pitting edema? It is the checking for bilateral pitting edema. You should apply normal thumb pressure on both feet. This like this one, and um, sorry, on both feet for 3 seconds. Uh, Again, I am repeating. For in the pitting edema, it's like a checking for bilateral pitting edema. You should apply normal thumb pressure on both feet for 3 seconds. It a shallow print persists on both feet like this one. Then the child has nutritional edema. This is the sign of nutritional edema. Now we will talk about the Bitos spot. What is the Bitos spot? Are the buildup of keratin located superficially in the conjunctiva of the human's eyes. They can be oval like this. This can be oval, triangular, or irregular in the shape. You can see in this one. The spots are a sign of vitamin A deficiency and associated with the drying of the cornea. When your cornea is drying, then Bitos spot could be appear. Next one we will discuss about the goiter. So a goiter is a swelling in the neck resulting from an enlargement thyroid gland like this. Worldwide, over 90% of goiter cases are caused by iodine deficiency. Now we will discuss about the dietary assessments. Assessing food and fluid intake is an essential part of nutritional assessment. It provides information on dietary quantity and quality, changes in appetite, food allergy and intolerance, and reasons for inadequate food intake during or after illness. Nutritional intake of human is assessed by five different methods. First one is the 24 hours dietary recall. Second one is the food frequency questionnaires. And third one is the dietary score method. And fourth one is the diet history method. And last one is the observed food consumption. So, first one is the we will discuss about the 24-hour dietary recall. So this method was designed to quantify the average dietary intake for a group of people, although it can be used to assess individual nutritional intake. During a recall, a client is asked to remember in detail every food and drink consumptions during the previous 24 hours. So we can define like 24 hours dietary recall is a trained interviewer asks the subject to recall all food drink taken in the previous 24 hours, and it is a quick, easy and depends on short-term memory but may not be truly um, representative of the person usually intake. Healthcare provider may promote, or you can say like that, healthcare provider may prompt clients to remember what they ate or drink by time period or activities like just after waking up, before going to bed, or to estimate portion size by looking at household measurement, models, or household utensils. Like you can see in these pictures, this is the this utensils is very big in size, and this one is little middle size in age. This is one with this small size in this age. So it depends on in which type of utensils you are using during during when you are taking food. So this is the main points recovered by the healthcare provider in the 24-hour dietary recall. Next, we will discuss about the food frequency questionnaires. So, food frequency questionnaires, or it's called FFQ method, is based on the principles as to how frequently an item is consumed over a period of time. Food frequency question is retrospective review of intake frequency, that is food consumed per day, week, per 15 days, per month. Report usually frequency of consumptions of each food item from a list of food item in reference to a specified period like past week or past month or past year. So in this method, organize food into groups that have common nutrients. It could be done by face-to-face interview, telephone, or by self-administration. So we can say, like, in this method, this subject is given a list of around 100 foods item to indicate his or her intake, frequency or quantity per day, per week or per month. It is a inexpensive, more representative and easy to use. So, limitations of this method is long questionnaires, errors with estimating serving size, need updating with new commercial food product to keep pace with the changing dietary habit. In this picture, you can see here the example. This is the example of food frequency questionnaires. You can see here this is the food items list. This is like the in a first day what you less in what you eat, and three in a day you eat less in a day, what you eat in 3 to 6 times you eat in a week, and 1 or 2 week or 2 month column, and never what you eat. This is the table you should mention here, like this. This is the beef, fish, and liver, poultry, eggs, dried beans, green leaves, and vegetables are here. Enter other food not listed that are eaten regularly. So you can just make a table and you can check out what you eat or what you never eat. So this is the method for the food frequency questionnaires. Next one is the dietary score method. Assign arbitrary score to the food under consideration on the basis of its nutrient contents. Consumptions of the particular food is estimated through frequency method. Frequency of consumptions of food, the total score and percentage are calculated. Better value if combined with quantitative methods. Next one is the diet history method. Responded reports are food and beverages consumed on a usual day to a trained interviewer. The interviewer then probes further on the frequency, amount, and portion size consumed. Diaries are sometimes used to assist response in recalling their intake. Access qualitative intake of food items and their frequency of intake, similar to diet history take in personal history of a patient, like used to study. First one is the meal pattern, second one is the dietary habits, and third one is the people's food preference and avoidance during special physiological conditions. And what is the advantage of dietary history method? Advantage is like responded burned in slow. uh, you can say like that, the burden of response is low and complete intake are provided. And limitations is like time consuming, need for trained interviewer, and lack of standardization. And last one is the observed food consumptions, the most unused method in clinical practice, but it is recommended for research purpose. The meal eaten by the individuals is weighted and content are exactly calculated. This method is characterized by having a high degree of accuracy but expensive and need time and efforts. So guys, hopefully you enjoy this lecture. And if you have any queries, then my mail ID and my number is mentioned in the first slides. You can just call me or you can just mail me, and for any query. You can also follow us by the Insta, Facebook, Twitter, and WhatsApp, YouTube. So thank you guys for the listening me.